This Sunday on Press Pass, Trumbull County joins the growing list of communities across the state and country that are taking the fight against the opioid epidemic to court. The county filing a lawsuit against 25 plaintiffs, including drug manufacturers and distributors. And the suit requests a jury trial, and any money recovered would go back then to departments that have been weighed down by the drug battle. Trumbull County Mental Health and Recovery Board Executive Director April Caraway is here to talk about this. Thank you so much for coming in this morning. This is the big story of the week, and I know we talk a lot about the opioid epidemic here on the news, and I know a lot of people don't want to hear about it sometimes anymore, but this is an important part. This could be a turning point. We're taking this battle not just from the front lines with law enforcement, we're taking it into the courtroom. Are you expecting results? Are you expecting this to head to trial?
I expect probably for them to settle like they did the last time that the big pharmaceutical companies were filed against because of how they distributed and promoted opioids and misled people into thinking many things, especially that they aren't addictive when we know that they are.
Yeah, it's startling to read the lawsuit. It's 270 pages. I read portions of it. Right. But when I was doing my report Monday, it is startling to hear just that they use deceptive marketing. For whatever you're alleging in this lawsuit, if it is proven to be true in a court of law, it is disturbing. There are multiple plaintiffs here. Do you expect all of them to play along, or will some be resistant? Because I saw some reports in Pennsylvania, at least one drug company came out and said, we're not paying, we're not going to be a scapegoat in this.
Right, I think all of them really would be afraid to be the first to settle because then it sort of dominoes. But I think taking it to court could be a long, expensive, drawn-out process also. You know, and I'm not a lawyer, I don't know, but right. I think the commissioners and the prosecutor's office had good foresight to join this lawsuit with many other counties, with the Attorney General's office, because, you know, the marketing that they did really targeted vulnerable people, especially veterans and seniors, to thinking that using these drugs will give them better quality of life, and it's just not true.
Yeah, and the commissioners you mentioned, they said they were hopeful in my interviews with them earlier this week. I saw Summit County joined the lawsuit as well, I think Tuesday. I saw that in the news. So we've got Columbus, they're just another area. Right. With all of the communities joining together, so the timing is now for this,
Timing is very good. I think it's just another approach to continue to reduce prescribing, and we need to continue to work with our states across the borders. You mentioned earlier West Virginia's #1, Ohio's #2, and that's because the systems weren't talking to each other, so people could get multiple prescriptions in Ohio and West Virginia, and now they've fixed a lot of that.
Yeah, doctor shopping, got to find a way to stop all of it. What is the best possible outcome for this situation? Get some money to help departments in our county, Trumbull County?
Sure. I mean, the money I think is good, and we need more for law enforcement, coroner's office, obviously for addiction treatment programs, but I really think that the media attention given to it, to continue to educate consumers that just because the doctor says you can take 4 pills a day doesn't mean you're not going to get addicted. It's chemically in your brain, your body. You will become accustomed to the drug and need more to get the effects to help your pain. So really to seek out other ways also to help with pain management.
Yeah, we want to be part of the solution. You were at some of the meetings that I covered for the Your Voice Mahoning Valley project that we're part of, and I appreciated sitting with you and others at those meetings, just learning about the impact it's having in every little corner of our community. It's different for parents, grandparents. Some of them feel like they need support, and so I was appreciative. I know that you have met with our editors, and we're not going to show the syringes as much as possible on the news. That is something that I really hope other media agencies adopt, because we don't want to induce more drug use in our community. Now, there was one more thing I saw. Opioids responsible for killing more Americans than breast cancer. Did you ever think it would come to this?
Of course not. No, I don't think anybody did, and I think that really goes to show, you know, I lost a friend to breast cancer, and when she lost her battle, nobody ever said she should have tried harder. You know, and so for the families who've lost people, especially now at the holidays, don't think, man, if he or she would have tried harder. Addiction is a disease. Your loved one just got overtaken by it, and just get the help that you need also. I mean, that's really the message that we want to give. You know, the stigma has to stop with blaming people for how their lives have changed because of their disease.
It's the only way we're going to get out of it, I think, too.
Yes.
Well, I really appreciate your time and your understanding on the topic, and hopefully we can work on more projects moving ahead, too.
Definitely. Thank you.
All right. Well, still ahead, we're going to talk about a call for support for the Youngstown Air Reserve Station.